Hey, Dr. Karl Stonecipher here, talking about the EBK device for a variety of disorders. First, for severe epithelial basement membrane dystrophy, this patient is unique in that she'd already had surgery in her other eye in the conventional fashion, and that's why I thought it was a great comparison. Her sister is a optometrist who she referred her in, and we did the original epithelial basement membrane keratectomy in the typical fashion without the EBK device. And her vision post-op day one was the typical, what I'm used to seeing, 20/50, 20/60, 20/70 after surgery. And we were introduced to this EBK device, which is basically removing a superficial epithelial cell layer over the surface of Bowman's. And then it has a device that actually lifts up the epithelium off of the actual Bowman's layer. So, you can see the irregularities that we're removing. And in the typical conventional fashion, I will use a diamond burr if indicated in a patient such as this to smooth out any other irregularities. In addition to the epithelial basement membrane uh, disease process, basically what we're trying to do is make a smoother surface so that the newer epithelium can grow in a more adherent fashion. In addition to the diamond burr, occasionally I will use also a light dusting with a PTK, but despite that, she was seeing 20/25 post-op day one, which was quite different than her previous experience, and she also felt that was more comfortable. This is a typical recurrent corneal erosion syndrome. This patient had been through anterior stromal micropunctures unsuccessfully, as well as medical management unsuccessfully. Obviously, it's an easier process to remove the epithelium in most of these patients, and I try to leave as much of the normal epithelium as I can behind. But this patient again, post-op day one, was seeing great. Now, typically for my premium IOLs, I will do a transepithelial PRK if it's a low level of myopia or myopic astigmat. In this patient, it was a low level of myopia that we were doing in a previous Symphony Johnson & Johnson lens, where the patient ended up with a residual of -0.5 and actually noticed that degradation of the vision. So we elected to proceed with a epithelial enhancement in this patient. The EBK enhancement was easily performed. The epithelial removal was typical, similar to a virgin eye, as we see with a typical PRK. As you see, this was a small treatment with great post-op day one vision, uncorrected vision, 20/25, and the epithelialization of these patients is usually within 3 days. So finally, the typical EBK for myopia. This is a simple -2.5. If we're trying to compare this to LASIK, obviously we would like for those individuals to see LASIK-like post-op day one so that they can compare with their counterparts. In this particular patient, we elected to do a surface laser treatment with the wavelight laser because of a thinner cornea and the issues associated with a -250 and a thinner cornea. I feel very comfortable in performing a PRK without cross-linking as long as they have normal topography, which this patient did. So again, you see the epithelial removal with the EBK device, and then a typical 2.5 treatment, which is fairly quick. And this patient, again, saw on average post-op day one, 20/20, and that's not an unusual picture.